Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a very interesting case of a lovely lady who travelled down from London today to see myself, and they suffer from a condition called Ichthyosis or Ichthyosis. And it's a rare skin condition. It can leave you with very dry, scaly, thickened skin and very tight skin. And it's normally congenital, but some people can acquire it in the early, or the symptoms become noticeable very early on in life. And this patient noticed their symptoms, or their family did at age 3, and it's mainly affecting their left side. So this is their left ear. And you can see on their forehand, and I think the patient mentioned around the legs, that they get really thick and blistered skin. It's really tight as well. And so they have to have their ears clean on a regular basis. Predominantly this is their left side. And you can see it's really thickened skin. And just to give you a bit of a backstory, this patient contacted myself probably, I think it was about just short of a month ago. And they had seen a couple of consultants in London who attempted to remove some skin off the eardrum. So I suspect everything I'm removing now was initially removed, and this is just because of the high turnover of dead skin. It's returned in such a short space of time. I think it was back. So I think it's in March time that they were last seen, and they attended twice to try to have some skin removed off the eardrum. And on the second occasion, they were advised to use some sodium bicarbonate drops, which really does help with dead skin. But the patient found it a bit uncomfortable to use, and unfortunately, the skin still remained on the eardrum. The patient found it a bit uncomfortable. There was some bleeding there. And so the patient did some research, as we all do now. We go online and came across myself and made the trip down today. And so we examined the ear. Their right ear was non-significant. I should have showed the clip actually, but it's just a little bit of dead skin near the entrance. The right ear, you can see that the skin is migrating off the eardrum and slowly out of the ear. So the right ear didn't require any treatment. It was just this left ear. Now, I did advise, because obviously I've not seen the patient myself. They booked over the phone. Because they're travelling such a long way, I did recommend that they use some drops prior to attending, ideally sodium bicarbonate drops. I find that just works better with the softening of dead skin. It breaks it down a lot better than olive oil, and just didn't want the patient travelling all this way, and we're not able to do much because I wasn't sure what the condition was. It could have been keratosis obturans, which sodium bicarbonate drops really helps. So they used some drops the last couple of days. Probably not as much as I recommended, but they did put some drops in, and you can see it has softened some of the skin here. Now, you can see the eardrum. It looks, it's all intact. It's completely visible, but there is this layer of skin there, and it's such almost a hidden layer of skin. It's very deceiving, and slowly I'm peeling away at the top. Now, I suspect this is the skin that was difficult to remove last time for the patient. I'm just using the fine end suction probe there. You may have seen earlier that I used the forceps as well, and that was because there was a bit of clarinetting. So to stop the clarinetting, I decided just to use some forceps. Because with this condition there, the skin can be very tight and dry and thick. Even with the forceps, it's very difficult to peel. And I'm obviously just been reading a lot more about this condition, and it is known also to affect people's hearing, and I suspect this is the reason why, because they get lamellar layers of dead skin. So the skin, as it dies and sheds, it should naturally migrate out of the ear, and as it's migrating out of the ear, you can see the sheet of skin. It should then slowly flake away into individual skin cells, almost like fish scales. It should exfoliate itself, but it's not. And this is the bit that was tricky. So I'm going to use some forceps in a moment, and there is going to be some blistering. You're going to see some vascularizations because the skin is so tightly adhered to the eardrum. And even at this point, you just don't know how much of the eardrum has got this lamellar layer. So when we say lamella, the structure of the skin, it's like onions. You got layers, thick layers, and we call that a lamellar structure. So there is some blistering there. It didn't cause the patient any symptoms. It's just a bit of vascularization of the blood vessels. They just dilated when I removed it. So now the forceps are just struggling to get grip, and I suspect some of the softer skin before had almost closed up some of the jaws, and I tried to wipe it down, but it just wasn't. So I just got a fresh pair of forceps out again. So sometimes you don't skimp on expense. You just you got to use the right tools. So I decided just to use a bit more suction here, and this skin it's more on the posterior canal walls, the back part, and also superiorly to the roof. They have got a slight I would say a narrowing of the ear canal, which can make it difficult to perform skin peels, because with skin peels you want that leverage, you want the ability to manipulate the instruments, because when you're peeling you're going to have to make long movements to stretch and peel away. I think we just used some oil before as well, just to loosen it. I'm going to use a bit more a bit later. So I just got some more forceps out, and you can see it's just got a better grip. So if you remember at the beginning of the video, that some of that skin was really mushy, and it gets in between the jaws, the teeth, so you don't get the same grip. So you can see that when we peel that away posteriorly, that's where the skin was really adhered. So there's just a bit of, as I said, you can see some redness there. We've still got, I got the majority of the skin out. We've still got some skin here. I'm just, again, slowly peeling it away, and I'm just going to introduce some more oil in a moment, just to lubricate it all. You can see it's just coming off the eardrum at the top, so hopefully some of the oil can seep in between. There we are, and I'm just going to perform some, I'm just using the fine end. So the fine end, I find it's really good with dead skin. It reduces the amount of clarinetting. So clarinetting is when you're suctioning, the skin violently flaps at the tip of the sucker, and it emits a very loud, high-frequency squeal. We call that clarinetting. It's not only loud for the patient, it's loud for myself as well. So with the fine end, you get less clarinetting, and the suction power is more concentrated because it's a smaller internal diameter. Overall, the suction power it's less, of course, but it's more concentrated at the point where you're vacuuming. So for dead skin, it's really good because we're looking to get a suction grip at a particular point on the skin, so we then peel it away. With hardened wax, it's a bit different. With wax, you want more surface area contact. With dead skin, because you're peeling it, we want a good, strong region where you've got a suction grip. So fine end works really, really well. So I'm just suctioning some excess oil out, and then we're just going to peel around. Again, there's another invisible layer of skin. Now, this patient is aware, and they have already been having their ears cleaned out on a regular basis. Previously, they've had it irrigated, which I advised them not to, because that's just going to exacerbate any skin condition. Water will wash away the natural oils our ears produce to protect the epidermis layer of skin and to keep the epidermis layer of skin moist and nourished and hydrated. And when you put water in it, it's going to wash away that natural film of oils that the ears secrete, which will then expose the underlying epidermis. So all the moisture within the epidermis will rise to the surface and evaporate, and you'll get dry skin, so we don't want that. I'm just having a close look at that. Perform tympanometry, normal middle ear function. So that was good. But you can see there's a bit of the yellow staining of the skin, which is lining the canal wall. And it's such a thin layer, this, and it's just it's a bit tricky because we don't want to make contact with the canal wall because it will be uncomfortable. So I'm just looking for another part of the ear to start peeling away the skin. So I'm just going to the front. And eventually we do get it all out. So one of the more complex cases, because when you do normally remove skin, it's not as adhesive as this. The skin was really tight and dry and thick. And of course, it's been attached to the eardrum for a while, since at least March. So just giving some patients some tips just to get them to use, because they don't react very well with sodium bicarbonate drops, just advise them to use some medical grade olive oil spray on a regular basis. And I don't think that's going to prevent this build-up of dead skin keratin, but it'll probably make removal a bit easier. And they're very grateful that they came across myself, so they're going to make the visit. We're going to monitor, but I think it's going to be between every 6 to 12 months that they're going to have to require this to be done. And they enjoyed the trip, so it's nice for them. It's a bit of an afternoon out. So it's just a bit of dead skin on the posterior canal wall. There's a bony ridge down. I was a bit hesitant to go for that, so I did show the patient there was a bit of dead skin, and they were happy for me to see if I can peel that away as well. Because with this condition, ichthyosis, as I said, it can cause a bit of pained skin because it's so tightly adhered, and it's almost compressed the region of the surrounding region, so it can cause tightness and itchiness. So this layer was almost invisible to the naked eye initially. I'm slowly just lifting it up and away off the canal wall. So you can see the ear is a very delicate structure. You can see that blistering occurring there. This is why we don't, we read in the comments that you should be using this instrument, that instrument, hooking stuff off the eardrum, but we don't want to cause trauma to the ear, because it's a very sensitive region now. Whenever we remove earwax, obviously we want to minimise any trauma or discomfort experienced by the patient. So throughout the appointment, just because I know that they were naturally a bit anxious because the last couple of visits, treatments I had was uncomfortable and it's unsuccessful for the patient. So just talking to the patient continuously, and at one point they felt as though they were nodding off, and they found it very therapeutic. They were a very calming sensation they were experiencing, and I can imagine if you've got this dead skin in your ear and it's causing a fullness and you can feel it being removed, it must be a very nice sensation. Hello, by the way, I know you're going to be watching this. I hope you had a safe journey back to London. So this is so in actual fact, this clip here actually showed the patient what was left, because I know they were keen for me to remove as much as possible, and I explained that there's some on the, you can see this little bony ridge here on the posterior canal wall, and so potentially could be a bit uncomfortable if we make contact. So, but they were happy for me to peel it away. I think that clip's coming in a moment, so it's still there. I was going to use a Jobson horn just to mop up some of the oils and excess oil, should I say, dead skin that was coating the canal wall as we're removing it. So this is just near the first and second bend in between. You can see the appearance of the eardrum compared to when they first came in. You can see that blue tinge to it, whereas before it was just yellow. It looked really dull. So here we are, just going to hover over and just kissing the surface, and that's the procedure done. So that vascularization should just calm down naturally. It's just, as I said, you get the blood vessels that dilate. Sometimes when you remove dead skin, it can happen on the canal walls, but it's like a bit of blistering. But that should be fine. I hope you enjoyed that video, guys. Take care, keep well, speak soon. Bye.